Hey Spencer, how much do dental implants cost?
That ranges depending on how many teeth you're doing. So if you've got a single implant where you have one screw and then you have the abutment and crown, which every implant should be three parts like that. You'll get the screw in there. That usually costs about 1,800 bucks, at least at our practice. I know East Coast to do the whole tooth, it's about 5 to 8 grand. Out here in Utah, it's anywhere from 3 to 4 grand. So you're typically looking at about 1,800 for the post, and then you got to wait 4 months, and then you do the abutment and crown, which are usually 600, 700 for the abutment, 900 to 1,000 for the crown. So after everything, you're typically looking at $3,400, $3,500. But that's just for one tooth. You don't know what's going on with the bone. Sometimes might need to take out the tooth, clean the infection, pack some bone in there. That has a couple. That might cost you a couple $100, and then we wait, put the implant in there. If it's on the bottom, it can be pretty straightforward. Like if the tooth's already missing, then it's 3,500 bucks. But it can move up anywhere to $4,000, $4,400 just to do one tooth, depending on where it's at. If we need to lift your sinus up, or if we need to do some bone grafting and things like that. If you're doing a bridge, which, I mean, this isn't with implants, but if you have two posts, let's say if you had two dental implants like this, and then you're putting a bridge. So if you had two posts like this with implants, and you're doing a bridge like that, where we put it on those two posts, you're probably looking at $8,000 to $10,000. At least that's the ballpark in our practice. Again, it depends. Are we down here and you're missing two molars? Are we going up top and doing a bone graft and a sinus lift to make sure that they can hold in there? And what's the infection look like? Where the nerves play? So it's really case by case when it comes to single implants and bridges, because you just don't know where you're going to have problems, how long it's going to take. Some people, it can be done as quick as 4 months, where we put the posts, heals up for 4 months, and then we can put on the rest of the pontic and the abutments to make sure that you have your bridge complete. But other times it can take longer. So one tooth, you're looking at 3,400 to 4,000 on average. If you're doing a bridge, it could be 8,000 to 10,000. It could go as high as 12,000. And if you're doing an all-on-4 for dental implants, which is where we would put 4 posts here, and then we'd take out all remaining teeth, or if you have a denture, we would just put in 4 implants, and then we can put on this block of teeth. The time frame on that just depends on where your bone's at and what it can handle. But these are typically, depending on what kind of material you use, anywhere from $18,000 to $24,000 at our office, and nationwide, you're probably looking at $20,000 to $25,000 per arch. There are some places that use cheaper materials, knockoff implants, so it can range. But I know that to do a full mouth replacement with implants, you're probably looking at $30,000 to $50,000 nationwide as the average. I know East Coast, some places are a little higher, could go 60 to 80,000. But the minimum I typically see is 30 to 50, depending on the material. If it's snap-in, if it's PMMA, if it's GCAM, if it's zirconia, if it's ceramic. There's a lot of different materials that can make the price vary, and how you finance it. So just to summarize, a single tooth, you're probably looking at 3 to 4 or 3,500 to 4 grand ish. Bridge, you're looking at 8,000 all the way up to 12,000, depending on where it's at and what you need to do to prepare it. And then for an upper and lower arch, anywhere from 18,000 to 24,000 per arch, meaning $36,000 to $48,000 to finish your entire mouth with implants, if that's what you're looking for.